Hello. Hello, everyone. Good evening to everybody. This is Harish from Nama Bengaluru Foundation. Welcome to today's video conference with our Honorable Deputy Chief Minister. And he will be joining us very shortly. He is in the middle of a meeting, and he has told us that he will join very shortly. Till then, please do bear with us. And I hope you are very well aware of the little do's and don'ts that we have put up on the screen. Please to stick to these requests. Make your points very short, crisp, and to be presented in a minute. You may also suggest your ideas in the chat room so that we can pick it up and present it to the Minister, Chief Minister. And please don't share your screen. And in case, we all know that not everybody can be covered in a short period. So we will definitely take it up to the Deputy Chief Minister later on formally. And also the Deputy Chief Minister office has requested us to not to keep him engaged for too long. So probably he will be with us for a short while, maybe half an hour or so. So let us make best use of the time to which he is available to us. So with that, I think we can wait for the Deputy Chief Minister to join us. Till then, please be patient with us. Thank you. Sir. Yes, please. Yeah. The Deputy CM is on his way. He will be joining us in a moment. Please be on alert. Let's welcome him first. Sir. Okay, can't find him, sir. ಯಾವ ನೇಮ್ ಅಲ್ಲಿ ಜಾಯ್ನ್ ಆಗಿದ್ದಾರೆ ಸರ್? Okay, yeah.
Hello.
Hello, sir. Good evening, sir. Namaste, sir.
Namaste.
This is Harish. ನಾನು ಹರೀಶ್ ಮಾತಾಡ್ತಿದ್ದೀನಿ ನಮ್ಮ ಬೆಂಗಳೂರು ಫೌಂಡೇಶನ್ ಇಂದ. Sir, can you hear us? Hello.
Hello, sir. I can hear you.
Yes.
I can hear you, sir.
Thank you so much for coming on board, sir. And we have RWA members, NGO members, and civil society members from all across Bangalore here with us today.
Sir.
And thank you for joining us. Sir, on behalf of everybody and on behalf of Bangalore Foundation, let's welcome you again, once again. Sir, all our members who are the participants here today have been working in Bangalore on various issues, especially during this COVID lockdown period, and they have been contributing in various ways. Hello, can you hear us, sir?
Please, sir.
Yes. So they have lots of challenges on the ground. They have found solutions on their own way. There are challenges now, and there will be challenges post-lockdown period as well. So they would like to discuss these challenges with you briefly. We know that the value of time you have. So as briefly as possible, we don't take much of your time, sir. That's one. Secondly, they would like to know how they can join hands with you, you mean the government, to help bring back normalcy into Bangalore. So these are the two issues they would like to discuss with you, sir. So in that respect, can I request you to make opening remarks? ಒಂದು ಮೊದಲ ಕೆಲವು ಮಾತುಗಳನ್ನು ಹೇಳಿದ್ರೆ ಆಮೇಲೆ we can open the floor for others to ask you.
ಎಲ್ಲರಿಗೂ ನಮಸ್ಕಾರ. I welcome all the participants, and firstly Nama Bengaluru Foundation for taking up this initiative of organizing the video conferencing with the various RWAs, NGOs, civil society, and very active people who have been doing an excellent job in the COVID situation, even before pre-COVID or during COVID. And normally they've been very active with regard to the various issues relating to Bangalore city. They've been doing an excellent job. Now, as in the COVID-19 situation, what has happened so far, all of you are aware, and what needs to be done also in future. Already we are having a line of action. Probably in the implementation level, in execution, taking it forward in the society is very important. And implementation is the most important thing. We can have a lot of guidelines, a lot of things, but ultimately implementation is very important. I would like to hear from all of you. I would like to ask all the participants, whatever you want to views and suggestions, you are most welcome. In between, I keep getting calls. That's one issue, sir.
No problem, sir. Not at all. We can understand your situation and position. Sir?
Always come forward. Yes, sir.
Hello.
Just a minute, sir. Just a minute, sir.
Yes, sir. Yes.
Just a minute, sir. Just a minute.
Yes,
We'll
sir.
go for 5-1, 5-7, 5-7. Now I request all the participants to come forward with your suggestions and your experience, what needs to be done, and any kind of advisory is welcome. Thank you.
Yes, sir. Thank you very much. Sir, I will open the floor. We have lot many members here who would like to interact with you. We may not be able to take everybody's questions and suggestions. So let us try to see how many we can accommodate. Sir, how much of time do you have with us today?
Half an hour, sir.
Half an hour. Excellent, sir. Thank you. So I will open the floor. Let us take one by one. Can I invite Gauri Acharya if she is, could you please unmute Gauri Acharya, please?
Yes, hi. This is Gauri. Can you hear me?
I can hear you, Gauri.
Okay.
Gauri Acharya.
Good evening, Dr. Ashwath Narayan. I'm a resident of Jai Mahal Extension. Been active in our neighborhood for quite a few years now. So we've been asked to concentrate only on one question or one issue. Our big concern is street vendors. Now, when we have street vendors on inside our residential area, we have people selling cooked food, and when that happens, there are groups of taxi drivers, construction workers, passers-by, truck drivers. I mean, there is a huge crowd outside people's homes, and it obstructs traffic. And most importantly, there is no social distancing in such cases. So this is something we really want to restrict. Actually, ideally, we would like to have street vendors moved to a certain area, give them a specific area to operate out of, and even there, they will have to have certain criteria that they have to follow in terms of hygiene, in terms of social distancing, some rules and regulations. I have sent Harish an email, and he can show it to you along with photographs. I have even suggested a place on Jai Mahal Road where it is possible to have something like this, where people can drive in, park their car, and buy what they want and leave from there. So our big concern is street vendors and street hawkers.
Yes, yes, Gauri.
That's it. That's my. So just want to know if you can address it now, or if you would like to address it later on. Also, it's fine. It's something to think about. Not a simple.
No problem. By the end, I'll conclude, madam.
Okay.
In the end, I'll conclude.
Okay.
I'll reply for most of your questions. Okay?
Thank you.
Okay, so you, sir, you want to have the questions first and then give a concluding remarks later on, is it, at the end?
Yes, sir. Otherwise,
Okay.
it will be.
Understand. Okay. Vikram Rai, please. Can we have Vikram?
Yeah. Good evening, sir. Dr. Sir, Vikram speaking, Secretary of the Bangalore Apartments Federation. I think our team members have met you previously, and we have had a long connection with you from many days. I think firstly would like to appreciate the role of the government for the active work, sir, in terms of keeping our ranking in the COVID index low. ಸೊ ಖುಷಿ ಆಗ್ತಾ ಇದೆ ಅದು ಕೇಳಕ್ಕೆ. ಬಟ್ ತುಂಬಾ ಕೆಲಸಗಳು ಇನ್ನೂ ಐ ಥಿಂಕ್ ಮುಂದೆ ಹೋಗ್ತಾ ಬಾಕಿ ಇದೆ. ನಮ್ ಕಡೆಯಿಂದ ಒಂದು ಕ್ವೆಶ್ಚನ್ ಇತ್ತು ಸರ್ ನಿಮ್ಗೆ. RWS ನ ಈ ಒಂದು ಸಿಚುವೇಶನ್ ಅಲ್ಲಿ RWS ಅವರ ರೋಲ್ ಅನ್ನ ಎಲ್ಲರೂ ಕೆಲಸ ಮಾಡಿದ್ದಾರೆ, ಬಟ್ ಇದೊಂದು ಆಪರ್ಚುನಿಟಿನ ತಗೊಂಡು RWS ಅನ್ನ ಈ ಒಂದು ಅಡ್ಮಿನಿಸ್ಟ್ರೇಟಿವ್ ಸಿಟಿ ಗವರ್ನೆನ್ಸ್ ಅಲ್ಲಿ ಫಾರ್ಮಲೈಸ್ ಹೆಂಗೆ ಮಾಡೋದು ಅನ್ನೋ ಒಂದು ಕ್ವೆಶ್ಚನ್ ನಿಮ್ಮ ಥಾಟ್ಸ್ ಸಿಕ್ಕಿದ್ರೆ ಒಳ್ಳೇದಾಗಿತ್ತು ಸರ್. ಟು ಸಿ ದಟ್ ಹೌ ಕ್ಯಾನ್ ದೇರ್ ಬಿ ಮೋರ್ ಫಾರ್ಮಲ್ ಇಂಟಗ್ರೇಷನ್ ಬಿಟ್ವೀನ್ ಗವರ್ಮೆಂಟ್ ಬಾಡೀಸ್ and RWS in implementing a lot of these measures. Yellow on kade, I think everybody has participated, gone with the flow, but I think there would be a lot more clarity which is required in terms of more formally integrating RWS into the governance of the city. So would be very keen to know your thoughts on that, sir.
So
Definitely, Vikram.
Yeah, so particularly how RWS can join their hands with you, sir, at this particular time, COVID-19. Yes. Can we have next speaker, Vinita, call, please. Please unmute, Vinita.
Sir, this is Vinita. My concern is regarding the fee hike, which is mind-boggling across Karnataka. And there has been a government directive where the fee hike needs to be rolled back. But private schools and other schools are not listening. The parents have sent an email also regarding this. So I'm a PTA member of the Vibcure High Harloor. So really need the intervention of the government in this to solve, because during this pandemic situation.
What is the percentage of fee hike has happened this year? Is it for this academic year?
Yes, sir, for this academic year.
For this 2021?
Yes, sir.
Already they have started collecting fees. What's the fees percentage? What is the increase in percentage, madam?
Around 10%.
10%. 10% fee has they hiked the fees by 10%.
Actually, 11.5%, sir. Yeah, 11.5%.
Which school is this?
Vibcure Harloor.
What name, madam? Can you repeat?
Yes, Vibcure.
Vibcure. Okay.
Yeah. And sir, not only Vibcure, I would also like to request on behalf of the other schools as well who are struggling for the same, sir.
Yes, I can understand, madam. Whichever school.
Yeah, so generally, it looks like this is the scenario, sir. I mean, so we can look at that. Can we move to next speaker, Shanti? Yeah, thank you.
Thank you,
Shanti Satish, please.
Shanti Satish.
Is she there? Shanti? Okay, if she isn't there, ilde idre ನಾವು ಲತಾ ಶ್ರೀ ಅವರ ಹತ್ರ ಹೋಗೋಣ. ಲತಾ ಶ್ರೀ, please. Okay. She doesn't seem to be there. Ahmad Ali, please.
I am the president of Richardstown Residents Association, Ward 60. We have been campaigning very strongly to follow the government instructions to all our residents through messages, WhatsApps, as well as circulars. Unfortunately, we are surrounded by neighborhood who are like Tannery Road and Lingarajpuram. So since we have a big park in Richardstown, they all come and join us. And there's a lot of fear in Richardstown whether this COVID will spread because of this. So my suggestion, which I've already made, is that instead of government taking on the responsibility and saying, stay home, take care, I think individuals, the government should spread a message like stay alert, take caution, be mindful, take your precautions. How much can the police help? Police has been extremely helpful. Our Tritheton police station personnel has been very, very good, I would say. But what can you do? People come, walk around without masks, without not social distance. Even now, when I went out to see, it is quite crowded around the park. So my suggestion is, I think individuals should take care of themselves. You are responsible for yourself, and spread this message across. In fact, I must say, we started calling back our mates almost 2 weeks back. They are more educated because we keep on telling them, you must wash, your hands as soon as we enter the apartment. Even at the gate of the entrance, we have kept sanitizers and water for them to wash. So I think they have become much more educated on the
Sir, I request you to be brief, please.
Yeah. So my suggestion, sir, instead of government saying stay home and control them, you suggest, and I think your stance should be stay alert, be careful, and the work and life has to go on. That's what my message to you. Okay.
Thank you, sir.
Thank you. Thank you, Amit.
The next speaker, Mr. Ramesh Dutt, if he is online, please. Okay, if he's in there, can we move on to Raj Duggar, please? Can you unmute Raj Duggar, please?
ಎಲ್ಲರಿಗೂ ನಮಸ್ಕಾರ. Thank you NBF for this opportunity. Dr. Ashwath Narayan, I am Rajkumar, convener of Citizens for Citizens. Sir, I would like to focus today on pollution of water bodies and particularly Namma Nadi Vrishabhavati. Combination of industrial pollutants, chemicals, garbage and sewage, and also lack of proper maintenance has converted this pristine and holy river into a stinking mori. The food grown using this water, the milk produced by cattle which feed on this water, and the water itself comes back to seriously affect our health. During lockdown, we have all seen how the water quality has improved. The water is clearer and there is no frothing due to almost 100% stoppage of industrial effluents and chemicals. ಬೆಂಗಳೂರಿನ ಮತ್ತು ಸುತ್ತಮುತ್ತ ಇರೋ 2 ಕೋಟಿ ಜನತೆಯ ಈಗಿನ ಕಳಕಳಿಯ ಮನವಿ ತಮಗೆ ಒಂದೇ. Please give necessary instructions to KSPCB and all other agencies. No industry causing pollution directly or indirectly should be allowed to start until it has put appropriate mechanisms in place so as to ensure zero pollution of land and water. I believe KSPCB has collected samples of river water for testing just now during lockdown. I am sure you are fully aware of all the facts. Also, because the river flows through Malleshwaram, the constituency represented by you, we cannot let the learnings of the lockdown go waste. This is the time to act and act firmly. We need our river back, sir. Dhanyavadagalu.
Thank you, Rajkumar.
It's a very important issue, sir. I mean, Bangalore, in this midst of all this lockdown and the challenges, has become so serene. It's so nice to walk around. Yes, sir. We will take how many? Shall we take another couple of questions for you, or
Please.
Yeah. Venkatesh KV, please.
Venkatesh.
ಹಲೋ ಡಾಕ್ಟರ್.
ಹಲೋ ವೆಂಕಟೇಶ್, ಹೇಳಿ.
ಸರ್, ನಮ್ಮ ಅಂಗವಿಕಲರಿಗೆ ಇದು ರಿಲೀಫ್ದು ಯಾವ್ದು ಸಿಗ್ತಾ ಇಲ್ಲ. ಯಾಕಂದ್ರೆ ಎಲ್ಲಾರ್ಗೂ ಆಗ್ತಾ ಇದೆ. ಪೂಜಾರ್ದು ಇವ್ರದೆಲ್ಲ ಆಯ್ತು. ಸುಮಾರು ಅಂಗವಿಕಲರು ಕ್ರೀಡಾಪಟುಗಳಿಗೆ ಈ ಫುಡ್ ಕಿಟ್ ಆಗ್ಲಿ ಬೇರೆ ಕಿಟ್ಸ್ ಆಗ್ಲಿ, ಯಾಕಂದ್ರೆ ದೇ ಆರ್ ನಾಟ್ ದಿಸ್ ಒನ್ ವರ್ಕಿಂಗ್ ಆಗ್ಲಿ ಏನೂ ಇಲ್ಲ. ಆಲ್ ಆರ್ ಸೆಲ್ಫ್ ಎಂಪ್ಲಾಯ್ಡ್. ಬೂಟ್ಸ್, STD, ಇದು ಜೆರಾಕ್ಸ್ ಆ ತರ ಇಟ್ಕೊಂಡಿದ್ದಾರೆ. ಸೊ ದಯವಿಟ್ಟು ಅವ್ರಿಗೊಂದು ಸ್ವಲ್ಪ ಹೆಲ್ಪ್ ಮಾಡಿ ಅಂತ ನಾನು ಕೇಳ್ಕೊಳ್ತಾ.
Yes, Venkatesh.
Thank you, doctor.
Sir, this is connected to the 1,600 crore package that is announced by the Honorable CM. So, so we can have a look at that and where this 1,600 crores goes, who are the beneficiaries of that. We should try to, we can take the help of RWAs and NGOs to make sure that this 1,600 crore goes to these beneficiaries, at least in Bangalore. So probably that is one point he was trying to make. So, can we have a Sunil Christopher, please? Okay, can we move on to Subhashini Jagannath?
1,609
Hello, good evening, Dr. Ashwath Narayan. This is Subhashini from Malaysian Swabhiman. Yeah, good evening. See, I have a question on this quarantine. So the interstate passengers, especially the ones who are traveling by private vehicles, their own vehicles, and they are not aware of the quarantine process and procedure in Karnataka. So they start off from Tamil Nadu or Andhra and whatever the neighboring states, and then they get caught unaware of the process, and they are put into some government schools or some quarantine facilities for almost 2 weeks. And they come thinking that they can come and do home quarantine, and but then it's not the case. And in fact, it happened in one of my friend's case, and his parents who are old, and also the family, the young daughter and then the wife. And what they're doing is they're having ladies in one school and then men in another, and it's a real hardship for them. And how, I mean, if you publicize this process across the country, maybe they will not even step out till everything gets, I mean, whoever need not come, at least they can be wherever they are. So I request you to publicize this process.
Yes, Subhashini, madam.
Yeah, thank you, sir. Thank you.
Vinod Jacob, please, if you can unmute.
Hello, sir. Very good evening. Vinod Jacob from Janagraha. Namaskara.
Namaskara.
Yes, sir. So nice to see you in the ration kit distribution at St. Joseph. And my question is regarding the lockdown. How will you go and what is the process to go for the unlocking Bangalore again? Because, we can't go beyond the lockdown period. And how the medical and healthcare facilities and the testing that is you are planning in Bangalore. Because, when you say red zone and containment zone, now we will all be crisscrossing through Bangalore. And as the the lockdown was removed, we saw the sort of chaos. So coming Monday, if you're really planning to unlock in and relax in a major way, how will you go about? And I don't see that in the red zones, there is a major amount of testing that is going on. Practically, I think this is a major cause of concern. And as a citizen of Bangalore, we would all like to know that how we could get the testing done and reassure and the immunity and also the medical facility and healthcare from your side, sir.
Yes, thank you, Vinod.
Thank you.
Sir, can we have one last question?
Yeah, please, Harish, sir.
Yes. Katyayani Chamraj, please.
ನಮಸ್ಕಾರ ಸರ್.
ನಮಸ್ಕಾರ Katyayani.
ನಾನು ಸಿವಿಕ್ ಸಂಸ್ಥೆಯನ್ನ ಪ್ರತಿನಿಧಿಸ್ತಾ ಇದ್ದೀನಿ. ಥ್ಯಾಂಕ್ ಯು ವೆರಿ ಮಚ್ ಫಾರ್ ಲಿಸ್ನಿಂಗ್ ಟು ಅಸ್ ಟುಡೇ. ಸರ್, ನಂದು ಒಂದು ಕ್ವೆಶ್ಚನ್ ಏನು ಅಂತಂದರೆ, ಈ ವಲಸಿಗರು, ನೀಡಿ ಪೀಪಲ್, ನಿರಾಶ್ರಿತರು ಎಲ್ಲರೂ ಇದ್ದಾರೆ. ಅವ್ರಿಗೆ ಕೆಲಸ ಮಾಡೋಕ್ಕಾಗಿಲ್ಲ, ಅವ್ರಿಗೆ 50 ದಿವಸದ ಮೇಲೆ ಅವ್ರಿಗೆ ಆದಾಯ ಸಿಕ್ಕಿಲ್ಲ. ನೀವು ಎಂಪ್ಲಾಯರ್ಸ್ಗೆ ಅವರೇ ಕೊಡಬೇಕು ಆದಾಯ ಅಂತ ನೋಟಿಫಿಕೇಶನ್ ಇಶ್ಯೂ ಮಾಡಿದ್ರಿ, ಬಟ್ ಅದನ್ನ ಹಿಂದೆ ತಗೊಂಡ್ರಿ, 2 ಸತಿ ಆಗಾಯ್ತು. ಎಂಪ್ಲಾಯರ್ಸ್ ಆರ್ ರಿಫ್ಯೂಸಿಂಗ್ ಟು ಗಿವ್ ದೆಮ್ ದೇರ್ ಸ್ಯಾಲರೀಸ್. ಅದು ಮಿನಿಸ್ಟ್ರಿ ಆಫ್ ಹೋಮ್ ಅಫೇರ್ಸ್ ಅವರು ಆರ್ಡರ್ ಮಾಡಿದ್ರು ಕೂಡ ಅದು ಯಾರು ಕೊಡೋದಕ್ಕೆ ರೆಡಿ ಇಲ್ಲ. ಆಫ್ಕೋರ್ಸ್ ಉಳ್ಳವರು ಉದ್ದಿಮೆದಾರರಿದ್ದಾರೆ, ಅವರು ಡೆಫಿನೆಟ್ಲಿ ಅದನ್ನು ಕೊಡ್ಬೋದು, ಅವ್ರ ಕೈಲಿ ನೀವು ಕೊಡಿಸ್ಬೇಕು. ಮತ್ತು MSME ಎಂಪ್ಲಾಯರ್ಸು ಅವ್ರಿಗೆ ನೀವು ಸಹಾಯ ಮಾಡಬೇಕು ವೇತನ ಕೊಡೋದಕ್ಕೆ. ಬಟ್ ಇವೆರಡೂ ಆಗ್ತಾ ಇಲ್ಲ. ನಾವು ಕೇಳ್ತಾ ಇದ್ದೀವಿ ನಾಗರಿಕ ಸಮಾಜದಿಂದ, ಎಲ್ರಿಗೂ ಯಾರ್ಯಾರಿಗೆ ಆದಾಯ ಹೋಗಿದೆ ಈ ನೀಡಿ ಪೀಪಲ್ಗೆ ಅವರೆಲ್ರಿಗೂ 1 ತಿಂಗಳದು ಅಟ್ಲೀಸ್ಟ್ 10,000 ರೂಪಾಯಿ ಎಲ್ರಿಗೂ ಸಿಗ್ಬೇಕು ಅಂತ. ಸೊ 10,000 ಅವ್ರಿಗೆ ಕೊಟ್ಟರು ಕೂಡ ಒಂದು ನಿಮ್ಮ ಕರ್ನಾಟಕದಲ್ಲಿ 1 ಕೋಟಿ ಜನ ಇದ್ದಾರೆ ಅಂತಂದ್ರೆ ಅಸಂಘಟಿತರು 10,000 ಕೋಟಿ ಆಗುತ್ತೆ. ಸೊ ಅದನ್ನ ನಮ್ಮ ರಾಜ್ಯದವ್ರು ಕೊಡ್ಲೇಬೇಕು. ಅದನ್ನ ನಿಮ್ಮ ಕೇಂದ್ರ ಸರ್ಕಾರದಿಂದ PM ಕೇರ್ಸ್ ಇಂದ ಈಸ್ಕೊಳ್ಳಿ ಅಂತ ನಾವು ಕೇಳ್ತಾ ಇದ್ದೀವಿ ಸರ್. ಆಮೇಲೆ ಬಿಲ್ಡಿಂಗ್ ಅಂಡ್ ಅದರ್ ಕನ್ಸ್ಟ್ರಕ್ಷನ್ ವರ್ಕರ್ಸ್ ಬೋರ್ಡ್ ನಲ್ಲಿ 8,000 ಕೋಟಿ ಇದೆ. ಅವರು ಕೂಡ ಬರೀ 5,000 ಕೊಡಕ್ಕೆ ಇವಾಗ ಒಪ್ಕೊಂಡಿದ್ದಾರೆ. ನಾವು ಅವ್ರಿಗೂ ಕೂಡ 10,000 ಕೊಡಿ ಅಂತ ಕೇಳಿದ್ವಿ ಒಬ್ಬ ರಿಜಿಸ್ಟರ್ಡ್ ವರ್ಕರ್ಸ್ಗೆ. ಇದೇ ನನ್ನ ಪ್ರಶ್ನೆ ಸರ್. ಥ್ಯಾಂಕ್ ಯು ವೆರಿ ಮಚ್.
Thank you, Katyani sir. I think we have enough. Sir, please.
Sir.
Please.
So many of our participants raise many of the issues, some related to COVID, some to general issues related to city. So first of all, with regard to the Gauri has raised the issue regarding the street vendors. As all of you know, street vendors, they are there across the city, every place, every city, every state. So regulating the street vendors has been a real big challenge. So, but anyhow, we need to address this issue. Regulating or clearing them of the street or the footpaths or is very important issue. For that, active participation, even for them, a provision has been made in the law, upholding some of their rights also. But pedestrian rights are more than any of the street vendors' rights. So we need to take up this issue. This issue is very important issue, sir. Unless we don't make footpath walkable, probably in the situation like COVID, you don't have to depend on the motorable services. So people can walk around, go to their various places, and it's very important to strengthen, promote walkable footpaths. Is very important. For that to happen, these kind of issues, street vendors or hawkers getting into the footpaths should be prevented. I think all the organizations strongly, we should be of the same opinion. Sometimes many of our people will be more sympathetic to the livelihood of the street vendors. And those aspects also need to have a more clarity, because over the time, these footpaths has become a very important for the have-nots. Most importantly, have-nots only have been using the footpaths because most of them depend, more than 50% depend on the public transportation system, sir. That is up to 70%. Even the senior citizen, children, everybody, they walk around in the footpaths. I completely agree. We need to address this concern. I think it should be more of people's movement also. We can't just keep away, because keeping them away, it's not a so easy thing. If you remove them for a day, the next day again, they'll be back there. Very difficult, and it's been very challenging. And this issue I've been seeing here, sir, for even before becoming a MLA, or before that, after that, and I am also working in this direction. Probably it needs to be taken very strongly by citizens and each one of us. And we'll see how best we can do things. And particularly, we are trying our best. We have started street road audits. Road safety audit has started. We are the first city in the entire country to start a road safety audit, particularly related to the pedestrian footpaths. We have started with 200 kilometers. Probably we'll be extending it to the entire arterial and subarterial roads. And we need to take up this issue, and we'll do our best. This is a challenge. We'll do our best, sir. And along with that, local participation. My friend Vikram was suggesting about the local participation. We at present have a ward committees. Ward committees are there. Most of the which has been decided in all the levels. It was the basically civil society that had taken up this issue. Over the time, because of all of your recommendation, RWAs, civil societies, NGOs, many of the organizations, Nama Bengaluru Foundation, Janagra, all of them took up this issue to have the citizens' participation in the administration and the local participation. So in this direction, ward committee is the most appropriate place for the citizens to participate. Along with that, you can participate in all the issues, and nothing prevents a citizen from getting involved in any of the issues. It is open, and RTI is there. Many other forums are there where you can connect with the system, and we can address many ways. You can reach out to the system. There are feedback, helplines, complaint system. Even Bengaluru Sahaya is there. Bengaluru Sahaya is there. Through Bengaluru Sahaya, you can raise any of the complaints. You can raise any complaints with regard to all the departments. You can raise complaints, and you can reach out to the authorities. There are many forums, many ways you can participate. Only thing is, you should have the interest to participate and have the concern for the people, fellow citizen, and for yourself, and to ensure that system services to improve. All of your active party, all of you have been participating. So far, all of you have been participating. Even every possibly all the citizens should actively participate. Then only we can make as our Ahmad Ali Sab was mentioning, we can make it a more responsible, alert, self-responsible for themselves, and being mindful. All these things can happen with the active participation. Then people will start becoming more responsible. Probably down the line in that direction, all of us need to get connected. There are challenges, there are obstacles, there are some of the things not going in the right way. I agree. But for that to be set right, all of us need to participate. We need to be an active connected with the system. I urge upon all of you to connect and impress upon all other fellow citizens and our friends to participate. Thirdly, with regard to the school fee hike, already we have directed all the institution not to go for a fees hike, and at the same time not to insist on the fees collection also. The fees collection also should be voluntarily, at least for the next 3 months. Don't insist, don't pressurize them to, even for the paying of the regular fees, don't insist. Let them do it voluntarily. Since now the situation is not good, they will not be in a position to pay any kind of fees. They should be given time. This is what the advisory being given by the government of Karnataka and government of India also. And first of all, fee hike should not be entertained in during this situation. Probably we'll call impress and we'll call upon all the institution to roll back all the fee hike. If anybody has done it, we'll ask them to roll back the fee hike, particularly for this academic year. Though there might be spiraling of cost, we call upon them to absorb all those costs. And this year we need to care for our own fellow citizens. We need to show that concern. We need to be more responsible. I think this is not the time to go for a fee hike. Anyway, we'll take up this matter seriously. Once again, we'll be sending a circular to respective schools not to hike the fees. Okay. Then being responsible, as Ahmad Ali Sahab has mentioned already, I spoke about it. And as my good friend Rajkumar was mentioning about the pollution of lakes, and as the environment pollution has reduced because of since the factories been shut, all the effluents discharging from the factories has completely disappeared. So only we can see better living conditions in the environment, as well as in the water flow, what has been flowing in our stormwater drain and nalas. I think, yes, I agree with you, sir. If our pollution control board is not doing its job, they need to do their job. Somehow things are not happening. The agencies which are supposed to perform their duty, they're not discharging in the right way. We'll call upon, and it's a open case, as you rightly said. It shows very visible that how things are happening. I completely agree. Even I'll call them, I'll inform them to understand their responsibility to do their job better and ensure that the pollution discharging into the lake should completely stop. It should not happen. And I think most of you, Rajkumar, you can continue to be active. You can ask many of your friends also to be active, so that it should be taken actively. Unless all of us don't participate actively, things cannot happen to our expected level. This is my frank. I'm not talking to you as as a deputy chief minister, even as in a fellow, concerned citizen, and as a concerned citizen just like you. When I'm also concerned, I also live in the city, and we need to all of us work together. Even I'll take up this matter, sir, and ensure that things will happen in a right way. And with regard to the physically challenged people, Venkatesh, you know very well, every month they get a pension of more than 1,000 rupees. Already they've been paid pension, and they have been given BPL cards, all kind of privileges, facilities, scooters, all kind of challenges, encouragement all the time. The physically challenged people have been provided. In this situation, we were not provided any kind of facility. They have been, given some kind of facility, sir. So this is not the time. Even I spoke to our Honorable Chief Minister with regard to the issue. But since already we are giving pension of more than 1,000, many more benefits. We give many benefits. Ration is provided because they'll be provided with BPL card. You know as very well, in BPL card, each person will be provided per head more than 10 kgs per month. Per head. At present, we are giving more than 10 kg rice per head, sir. And along with that, 1 kg tur dal and many more things are given to them, and free gas cylinders. Many of the facilities, many things have been given, and many other facilities also are provided for the physically challenged, and not only for physically challenged, many categories, there are many facilities. So with all these things, and we are asking about the package, sir. 1,600 crore package, 1,600 crore along, in addition to 1,600 crore, we have given 162 crore package also, plus today we announced one more package, that is 525 crores package also has been announced, sir. So basically, you'll be surprised when our Honorable Prime Minister was addressing our citizens of our country across the world also. Now the transfer and delivery of the money, what has been given as a benefits to the people, sir, there's no leakage, there's no pilferage, sir. You'll be surprised. We make use of the DBT and Aadhaar, and instantly, within no time, we can reach out to the targeted people without any misuse. They'll get into their respective bank accounts, sir, and nothing will go. It cannot be taken away by somebody else. Nothing goes waste here. Nothing has been pilferage, no pilferage, nothing, sir. Direct benefit transfer is there, and with Aadhaar, with unique identity, and all the due formalities will be adapted. And now the benefits whom we are given is to the barbers, washermen, taxi drivers, NECAR means the people who work with the handlooms, floriculture, construction workers, and the washerman then chamar, cobblers, and many other categories have been given, sir. Even the maize growers, they had very bad pricing. Even for today, we announced for the maize growers also. There are more than 10 lakh maize growers. We are giving each person 5,000 rupees. So totally, we are now giving more than 2,200, 2,300 crores, sir. All this benefit will be directly transferred to their respective accounts. This is about the package, sir. Even from the government of India, more than 1,70,000 crores Garib Kalyan package was announced. Later on, now 20 lakh crore package has been announced. Many things, many of these benefits have been transferred. And with regard to the wages also, we are trying how best we can get their wages paid by respective industries. So if some of the people are in a position to pay, some people are not in a position to pay the wages. So whatever can be done by government also, we are trying to do our best to these employees and construction workers. We have been providing ration right and left. Everybody has been provided. There's no pilferage, and we are trying our best. Nothing goes wrong. Even transport, allowing people to migrate from one place to another place. All the best possible things have been provided to each one of them. Even then, we do have some of the challenges because they try to get out of the system. There are pass system, consent system, screening, lot of procedure and modalities are there. If one person wants to migrate from one place to another place, there are a lot of conditions because the receiving state also needs to agree. Even if you want to allow them to go to their respective state, the receiving state many of the time don't agree, or the vice versa. So many of the people even migrating back to Karnataka also, as our Madam Suhasini was mentioning, that they are put into institutional quarantine. You know very well who is exposed where, nobody knows. So that has been the mandatory. We can't have exception. People coming in private vehicle, people coming in public vehicle. There's no discrimination. Overall, it's in a concept or a method. Modality has been adapted for each of them to get screened, stay in a quarantine. They can have a paid quarantine. They can have a free quarantine. Paid, you can have any kind of facility, 5-star, 3-star, 4-star, any star, are at the same time free. Who can't afford can be provided the free quarantine, but this has become a mandatory. But we are given some exception to some of the pregnant ladies, senior citizens, children below 10. Some of the exceptions have been given, terminally ill people. So these are the exceptions given, but we need to see way forward how we can go about it. And my friend Vinod Jacob was mentioning about the unlocking Bangalore. So red zone and containment area, all those things. So the most important thing, what we are looking forward is to serve complete relaxation in the red zone, except the containment areas. So in the containment areas, none of them can crisscross in those areas. Containment area will be completely sealed. Completely will be sealed, and nobody can access those containment area. It will be around 50 meters to 100 meters area will be called contain. Wherever infected people are clustered, whoever is living in that area, a containment area will be fixed in that 50 to 100 meters area, and nobody can access, nobody can go in, or nobody can come out. So except those activity will not be allowed in containment area. Other than the containment area, rest remaining area, we are impressing upon, requesting the government of India to permit the activities to take place similar to the green and yellow zone. On the similar lines, we expect Bangalore city to be also unlocked, and we are trying our best to. So for all the 3 phases of relaxation has been permitted. So for many of the sectors, activities has picked up, and they've started working, not to the full pace. In a very small way, things are happening. Over the time, probably we are trying to get into normalcy. You know very well, virus is going to be there with us for much longer time. How long, I can't tell you, but it will be there with us until we develop a vaccine or a cure. Some therapeutic has to be provided or developed for the treatment of the COVID-19. And rest remaining is the prevention. We need to work on prevention, and we need to ensure in each and every person that awareness needs to be created with regard to what kind of measures to be taken for himself to protect himself. So far, many of the people are aware about the physical distance, hygiene, and the mask to be worn by them. And with regard to the system, also is monitoring any of the suspected cases, positive cases, infected cases moving around. We're trying to regulate so that the primary, secondary, tracing, tracking, many of the things effectively we are trying to, by using of technology, even in our state level, we are trying to do our best. So many of the methods we have developed. 104 through we have a real-time data collection technology platform, Aptamitra, Watch, many things we have developed, many things, and along with that, Arogya Setu is there, which is mandatory. Through that also we are trying to do our best. Down way forward, we could see some relaxation in the days to come in the methods of isolation, treatment, quarantining, because once if the load increases, over the time simplification will come into a picture. And as on today, the testing capacity of our Karnataka state, we can test more than 8,000 samples can be tested. If pooling is allowed, we can have pooling is 1:5 ratio. 1:5 people can be done, and we can multiply into 5, and that kind of numbers can be done. So far, we have not started pooling of testers. We'll be shortly starting wherever we want to do the population survey or some of the societies, some of the localities, if you want to go for the mass survey, mass screening, we can adapt pooling methods. And so far, we have not started the rapid tests for the epidemiology surveillance or the screening. So far, we have not started with the rapid test. Since the efficacy of the rapid test was questionable, it was below the 75% efficacy. So once we get a right rapid test kits are available, we'll be going for the population survey. So checking whether the antibodies developed people are there, herd immunity, many of the surveillance can be effectively done. At present, we have been doing an extremely good job with regard to the number of beds available for the COVID-19 patients, the testing labs. At present, we have already more than 35 labs to do the testing. By the end of this month, we'll be having around 60 labs where we can conduct the RT-PCR tests. So many more solutions also we are working out, and at the same time we are ensuring the system is in place, and we have integrated the technology where we can reach out to any person, whichever doctor he gets examined with any kind of ILI or SARI cases. Immediately we'll get report from any consultant, whoever is examining any patient. Immediately we get the report, or from the drug counter or the pharmacy. Immediately we'll be getting the information, and system is very active and alert. And we are doing universal screening of population also across the state. Each and every household we are screening for the comorbidity cases, vulnerable groups, and we are taking all the adequate measures, and we are coming out with a lot of solutions. And all the technology has been put into maximum use to ensure that system will be robust to address all the people concerned. Even for any number of cases also there, we will be able to manage, monitor, address, treat, do everything. Thank you, Harish sir. Anything more, sir?
Sir, there are so many congratulatory messages in the chat room, and there are so many questions and suggestions as well, which we will all collate and send it to you formally later on, which for your kind consideration, sir, please.
Thank you, Harish sir.
Yes.
My friend Ramsamy Saab is there. He just
yes, right. He is. Yeah. So, sir, I think we need to let you go. And I once again thank. Do you want to speak to him, sir?
Ramsamy Saab.
Ramsamy, please.
I'll call you later.
Yeah.
I'll get in touch with you, please.
Please, if you have anything to say to sir.
No, it's too short a time.
Yes. Yeah. Thank you. Sir.
Our conversation will be for a long time, sir.
Yes. Sir, on behalf of all the members here present, RWAs, NGOs, and civil society members, we thank you, and we hope we can have a session like this with you again sometime.
Yeah, definitely, sir. I look forward anything, sir. And it is very easy also. You can reach out to each other, and
yes.
we can address the most important issues, and we can sort out, you can communicate, and I am always there. Whatever best I can do, I can spare my time, and we'll do our best.
Thank you, sir. Can't thank you enough. Thank you very much, sir. Have a nice day. Thank you very much. Thank you.